The patient's name is Chip. I've known him for years, so started coming to me several years ago. But he's a type of patient that comes only occasionally when there's a problem. Kind of put him in a category of dental neglect. Someone who, when there's an issue, they will come in, but they will not come in periodically. And so he's been coming to me for years. We've talked about doing some treatment on some of his teeth. He was having some gum issues. He even had an infection at one time, and he just never seemed to be motivated at the time to have any actual serious dental work done. I think we had maybe small little increments of fillings here and a crown here on teeth that had issues. But then he started having some chronic periodontal issues, mainly because he was a smoker. And he was in pretty good shape. He took care of himself, but unfortunately, the smoking caused a lot of periodontal issues. These periodontal issues, gum issues, also were so severe that it ended up causing some of the teeth to abscess. When that happened, we were at a position where we were unable to actually even salvage or save these teeth because not only did they have an infection on them, they didn't have much bone support as well. Hi, I'm Dr. Rob Lovato. I'd like to introduce my good friend and long-term patient, Brad Marlin. I'd like him to explain to you his journey that he had here at this office. And also I'd like you to tell us what brought you here, how was your experience, how were you treated, and how do you feel the end result was?
Thank you. I'm Brad Marlin, and I've been coming to Robin for my regular dentistry for many years leading up to this. We in the last couple of years started chasing problems, broken teeth, bad crowns, and so on and so forth, some infections and whatnot. Honestly, the pandemic happened, and we all, mostly me, neglected that side for a couple of years, and the problem had gotten worse. So I came in and a little timidly, he didn't take me back to the chair that morning. He took me into the conference room and started to explain what was going on with me. And of course, I was a little nervous about it. And then he was talking to me about what we could do as going forward. And he brought up doing the dental implants. And honestly, I went home with that information and I was a little scared and ashamed and all of the things that I think humanly we would go through, because it's quite a leap age-wise and condition-wise and what have I done wise and things along those lines. But he has a very nice way of he can calm that. And so I went home and had thought about it for a while and did a little research and found some testimonials that kind of halfway gave me, which is unfortunate, that it halfway gave me some answers and started to reduce that fear once I realized what it all entailed. And we got on board with it. Chip was a classic example of the direct relationship between oral health and overall health. When he came in, I had to take care of a couple of immediate problems, which were some bad infections on some teeth on his right side, ultimately resulting in 4 teeth to be removed. By the time he was getting more serious about his treatment, he was now down to about 20 teeth left out of 32. Doing a comprehensive exam, we came up with a couple of different options. Because there was such a chronic periodontitis or gum disease, the base or the foundation of the teeth, the bone that supported the teeth, was non-salvageable. We couldn't do anything to add bone to these teeth to make them stable. So we came up with a couple of different treatment plans. A denture, in his case, was ultimately the best choice for him. There's about 10% of the American population that actually have dentures and wearing dentures. About 42 million U.S. citizens are actually wearing dentures. And you usually will get a denture, the age range is between about 40 and 49. So, in the 40s, early 50s. Chip was right in that area. He was about
58, 59 years old when we noticed these issues were ultimately going to end up in a denture. And so in his case, we knowing that dentures were the route we were going to go, he also understands that dentures don't fit well. I mean, we can make them. I can make them fit very good, but the problem with the lower dentures is the bone resorbs quickly, and therefore that lower denture is going to move around every time he eats. So you lose a lot of your efficiency. You lose a lot of your taste, and basically, eating is not as fun as it should be. And he knew this was going to be a challenge, one that he did not want to face. He knew that having them mobile, moving, being able to come out, getting loose, not only would affect him psychologically, but at the same time, he was a hairdresser. He was in the public. He spoke all the time, and he didn't want to have to deal with that issue. So the option for him was what we call an all-on X. It's where it's an implant supported denture, whereas you can remove a lot of the areas that would cover parts of his mouth that would be uncomfortable, as well as be secure. It's going to stay there. It's not going to move. You allow him to eat just about anything he wants, anything from steaks to nuts. This being the best option for him, we then started with the diagnostic information. First thing we want to do is, work on his health and see where he's at. He was in pretty good shape, ate pretty decently, but his BMI was a little high. So we thought, okay, send him over to the oral surgeon. We'll have a consultation from there, get him referred out to his primary physician to see if he's eligible health-wise. And it turns out that he had high blood pressure that he wasn't aware of. His cholesterol was out of control, and he also was pre-diabetic. And here's a guy who never thought that was any issue. He didn't feel like he had any problems. He didn't look like he had any issues. And so the first thing we needed to do was for him to change his lifestyle.
So, we not only got on board with what we were going to do, but what we were going to need to do to lead up to this initial procedure. And a lot of it had to do with my health. I had gone to, I had to get a doctor's, approval, a doctor's recommendation to do the surgery. I found out I had a bunch of other things going on, which thanks to Robin's support and thanks to the support of my family and the people that care about me, was able to get right on board with. I have to say, I used to also be a smoker, right, and then gave that up first, and then got on a healthier diet and whatnot. They put me on all the pills. They put me on stuff for blood pressure, stuff for blood sugar, stuff for cholesterol. But with a solid change of diet and life change, I was off all of that stuff within 90 days. I was quite a bit heavier when I began this journey, and which led to the other ailments. And the reason that I jumped on board with getting right with those things is because I knew from my research and from the recommendations of Dr. Lobato and my physician that my healing process would take a lot longer, maybe twice as long as it would if I hadn't gotten on top of this stuff.
And that's when he got motivated. He was motivated not only to do the all on X, but in order to do that, he had to change his lifestyle, and he was motivated to do that. He quit smoking. He changed his diet. His cholesterol dropped. He no longer was pre-diabetic, did not need to take any medication for that. And his blood pressure also went down, and he came off his blood pressure medication. But he had been on it for about 3 to 6 months prior to us doing the surgery. So once he became a good candidate, we then did pre-diagnostic pictures, x-rays, CBCT scan, which is an x-ray that lets us see where his mouth has bone and where it doesn't have bone, allows us to determine where to place implants and make sure that we put them in an area that is away from any kind of vital structures, sinuses, nerves, anything that may be a vital situation that we want to avoid. with this information, taking pictures, pre-pictures, knowing where his lip dynamics are, where his teeth are, the height of the teeth, how much bone he has. Putting this all together, we were able to come up with where we'd want to place the implants, as well as what the teeth would look like on the final, or as close as we can come to the final. So from there, he was referred to an oral surgeon, and the oral surgeon did an amazing job with this information, was able to remove all the teeth and place 6 implants on the top and 6 implants on the bottom that would be securing the denture, which was placed at the time of surgery. So by having that CBCT scan and the pre-ops, you're able to determine successfully where we can place those implants and be able to create a surgical guide that allows us to know exactly where the bone is, where the healthy bone is, where we can place them to avoid sinuses and get a successful implant placement.
So I got on top of this. I got the approval. We did the surgery, 7.5 hours under sedation. That's why I needed the approval. The oral surgeon that worked with us, another tremendous guy. Now he's a dear friend too. He held my hand through this whole thing, and we started the healing process. And all in all, it took about, from the surgery day to the final teeth, was about 6 months exactly, which is exactly what he had told me, even though I was calling him every 4 months, or after 4 months and 4.5 months. And it's like, I'm ready. But he knew.
At the time they removed the teeth, placed the implants, they actually have prefabricated the denture. So that the denture will then sit right directly onto the implant. And that's the great thing about today's times. Utilizing these diagnostic information, we can actually fabricate a surgical guide that tells us exactly where we're going to place that implant, and then be able to also fabricate a model that would fit on top of those implants completely and securely. And therefore, from the minute that he left the oral surgeon, he had those dentures securely placed in his mouth on implants and was able to eat that day, that night.
My teeth were they were super worn down and flat, discolored. I had a root canal done on my very front tooth right here that was discoloring. It wouldn't match the other teeth. Whether the other teeth were changing color and that one was staying the same, I don't know. But and then my gum recession had gotten to a point where it was kind of embarrassing. People that would ask me what was in my teeth, and it was just the hole from the gap. And so I started to get a little self-conscious. I changed my smile. It was like only a half smile because I only wanted a certain part of my teeth to show. So there were the cosmetic sides of it, but it mostly was due to my health. I think that we have learned so much more about dental health and overall health. I'm actually surprised that they're not super combined on the medical side. As we come to these discoveries, like every infection goes through the whole body.
Normally, when you place an implant, we don't want any type of micro movement, and we therefore usually make them stay away from that implant for at least a minimum of 3 months. And that's when we can go ahead and restore it by putting an abutment and a crown on it, like you'd see for a single tooth implant. But the All-On X allows the distribution of forces to go amongst all the implants so that there's minimal movement, and therefore you can actually eat right away. So he went from teeth that had spaces, his gums were receded, black triangles from the recession, missing back teeth, to having all his teeth in one sitting.
I had hesitation, but I don't think it was an abnormal hesitation of any kind. I think it was just that the if, ands, and buts kind of it. I should have done this and I could have done that. But the truth is, I was at the spot I was at when we did the initial consultation about it. I actually came to Dr. Lobato initially to talk about. Once he had said, "Hey man, we can go this route," I knew he would be the guy to talk to about this stuff. So I was a little worried about my health. I'm 60 years old. I was 59 when we started this, and we start, it's unfortunate we start taking better care of ourselves as we get older, but we don't see the necessity until then. But I would say that it was probably an even combination. I was health and looking better because the psychological side of the embarrassment of my teeth, or even the embarrassment of losing my original teeth and doing these, that story in my head plagued a little bit. But once I did some research, and I recommend to anybody that they do their research. You won't find a lot out there right now. Hopefully this testimonial will be that more answers. And maybe we can do one that actually gets into what my chewing experience, all of those things. It's been a miraculous change. Absolutely a miraculous.
So the process would be remove the teeth, place the implants. There's a healing denture that the patient wears for a couple of months. Then a PMMA is fabricated. From there, we determine the bite, the shape, the color. Make sure the patient is happy with the aesthetics and the phonetics. Make sure that the speech is good. If there's a need to get a new one made, we would rescan the mouth, which means, in other words, so when there's healing going on, you might get some resorption and loss of bone and loss of tissue, and there would be a space between the tissue and the actual denture. And so we would rescan, and then we can fabricate a new PMMA that fits better. And once we have that dialed in and the patient's happy with the looks, they're happy with the bite, then we would scan that, and then we make a zirconia. You can make as many adjustments you want on a PMMA. They're easy. You can adjust the bite. You can scan and make a new one because they're all fabricated in the office. But the zirconia is so strong, you can't make any changes. And if you do, they're very minor. So you use that PMMA during that healing process to come up with the perfect shape, model, bite, size, and that's what you replicate in the zirconia.
I smile. Yeah. That's the difference. I had a full smile. There's no cover up at all.
So you say that was what was the biggest impact
on my smile? Yes. I've been in the fashion beauty industry my whole career, so I started to get a little self-conscious for sure, and all that went away.
The looks, the aesthetics of it are fantastic. I mean, here's a guy who went from having a pretty decent smile, but teeth that showed wear and tear. The color was bad. The loss of tissue and the black triangles. And now I can look at him, and when you see him smile, you just smile yourself. And that's what I see from every one of the patients that we do these all on X's is they are now smiling more than they ever have, and with confidence. But you could get similar results with dentures by themselves, but what you can't get is the chewing efficiency and efficacy. They are now, when you have a regular denture that can potentially move, you're limiting on what you're eating. You're going to more softer foods. Usually those foods are going to be high in caloric. Usually they're not the proteins, they're the carbohydrates. You're not seeing people eating steaks and nice chicken sandwiches. But with the All on X, there's nothing they can't eat. And here's a guy, which really makes me excited on all my patients, that here's a guy who had multiple teeth in the back missing. So even if he had a steak, he had to move it around to only some of the teeth that actually could do the chewing. Now he can eat a steak without a problem. And so you're getting everything you could ever want. You're getting your smile back, confidence back, you're getting your chewing back. And it's good. It makes me feel good that I can be a part of this, instead of just seeing somebody else. I mean, we're not, we're not saving lives, but coming close to it. Um, you do see patients who have a lack of chewing efficiency, and you see them start to dwindle because of the lack of intake, and basically it becomes their demise. And here's a situation where we've extended his life and joy of life by not only having a smile, but able to eat whatever he wants and know that he's now healthy again.
Everyone thinks it's absolutely amazing the difference. They don't. I don't know if they talk about the difference, but they love what I have now. They would, of course, never say that. It's like, oh, your teeth look like blah 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 or any of that. But they do really like it. I also kept in communication with everyone through the whole journey, from when we made the solid decision that this was the route we were going to take, with my coworkers, so everyone knew that I was going to do this. I feel great, man. Again, I'm confident with the smile. I'm confident with with my healthy choices, what that's led to. I'm so happy with the results of and the journey that I went on, that I'm willing to sit and tell my story about. Overall, I feel grateful. One, that these types of treatments are available to human beings today. Two, that I had the right person in my life to talk to, because Robin and I aren't just patient doctor, we're also good friends. With the right team around you, including the oral surgeon that was brought on board. I mean, it was a team effort, man, and just as life should be. And I have to say that I'm a pretty confident person. I was an overcoming in confidence, and since this whole journey has developed a confidence in me that's cleaner. It's pure. I don't have a bad word to say about my experience. The surgery was exactly the way they described it would be. The process of healing was exactly the way they described it would be. I went through 3 different sets of teeth. These are the finals, which I hope everyone loves. I mean, I really didn't know about any of this stuff before I came in. I thought I was we were going to just chase broken teeth and infections for the rest of my life. And this has been an incredible eye-opening journey and the possibilities of advancement. I've got family. I've got an endodontist in the family who's retired now. Him and his wife she's a hygienist, and the first time they saw me, they couldn't believe it. I mean, and that's a person in the field.
Yeah.
So that's a good compliment.